Knock, knock. Come in. Hi, I'm Adrienne. I'll be your nursing student today. Can you please tell me your name and date of birth?
Tanya Lynn, 1170.
Okay, and we're going to be performing a musculoskeletal and neurological assessment on you, if that's okay.
Good.
So wash my hands. First, I'm going to test some of your cranial nerves. So first, I'm going to have you close your eyes. I'm going to provide a scent, and you're going to have to identify what the smell is.
Eucalyptus.
Good. Now I'm going to take my Snellen eye chart, and I would stand about 20 feet away. I'm going to have you read the smallest line of letters that you can while covering one eye.
CBDPST.
Okay, and now cover the other eye.
CBDPST.
Cool. Perfect. Okay, now I'm going to take my pen light, and I'm going to be assessing your pupils for parallel. So I'll take my pen light. I would come in at the side and shine on the pupil and make sure that both of the pupils constrict at the same time. Okay, next I'm going to have my pen light, and I'm going to have you follow my pen light, and I'm going to be doing this test using the 6 cardinal fields of gaze. So watch my pen light, follow it just with your eyes. Okay, now I'm going to assess cranial nerve 5. So I'm going to have you clench your jaw, like clench your teeth. And I'm going to try and pull down on your jaw. Good. Okay, now I'm going to assess your sensory function. So I'm going to show you what pain and light touch would be. So this is going to be pain. Okay, and this is going to be light touch. Okay, so I'm going to touch parts of your body, and you're going to have to tell me whether it's pain or light touch. Okay, while closing your eyes.
Pain. Light touch. Pain. Light touch. Pain. Light touch. Pain. Light touch.
Okay, good. Now I'm going to assess cranial nerve 7. So I'm going to have you smile for me and frown, and then puff out your cheeks. Okay, good. And then for cranial nerve 8, I would just perform the Renee and Weber test for your hearing. And then cranial nerve 9 and 10, I'm going to have you swallow for me. Okay, and then I'm going to have you stick out your tongue and open your mouth and say ah. Okay, and I'm looking at the uvula, making sure it's midline and raising. And then I would assess cranial nerve 11. So I'm going to have you shrug your shoulders against resistance, and I'm going to have you rotate your head left and right against my hand. Good. Okay, and lastly I'm going to have you stick out your tongue and move it side to side, and then poke the inside of your cheek. Perfect. Okay, so now I'm just making sure that the patient is alert and oriented. So can you please tell me where you are?
I'm in the hospital.
Okay, and what are we doing right now?
A nerve test.
Yes. And then can you tell me who the President of the United States is?
Donald Trump.
Okay, good. Now I'm going to assess some of your motor function. So I'm going to have you stand up for me. And I'm going to have you point, and I'm going to have you touch. I'm going to have you take your arm and touch your finger to your nose with your eyes open. Okay? And then I'm going to have you do the same thing but closing your eyes. Good. Okay? And then I'm just going to have you do some rapid alternating movements with your hands. So I'm going to have you slap your thigh with the palm of your hand and the back side of your hand and alternate that fastly. Good. Okay, I'm going to have you tap your foot. Okay, and then I'm going to have you stand on one leg and hop. Good. Okay, perfect. Now you can, I'm going to assess your range of motion while you're standing up. So I'm going to abduct your arm and adduct. Same on both sides. Okay, I'm going to have you look to the left and to the right. and look up and down. Okay, and then I'm going to have you sit down for me. And I'm going to have you lift your leg up and down. And the other one. Okay, perfect. And I'm going to ask you a couple questions about your daily living activities. So can you brush your teeth on your own?
Yes.
Can you get dressed?
Yes.
Can you bathe?
Yes.
Can you eat on your own?
Yes.
Okay, perfect. All right, and now I'm going to assess some more sensory functions. So what I'm going to do is I'm going to show you 3 objects, okay? So these are sunglasses, this is $1, and this is a knife, okay? Okay, and then I'm going to have you close your eyes for me, and I'm going to trace a letter on your hand, and you're going to have to tell me what letter it is.
A.
Okay, perfect. And then I'm going to have you tell me what the 3 objects were that I showed you earlier.
Sunglasses, dollar, and knife.
Okay, perfect. Now close your eyes for me. And I'm going to give you an object, and you're going to have to identify what the object is.
Sunglasses. Knife. Dollar.
Okay, good. And then I'm going to touch some parts of your body, and I'm going to have you point to where I touched, okay? Close your eyes for me. Mm-hmm. Okay.
Shoulder.
Okay, perfect. All right. Now I'm going to take my reflex hammer. I'm going to test some of your deep tendon reflexes. So first I'm going to assess your bicep. So I would take my reflex hammer. Okay. Your tricep. Okay. Then your brachioradialis tendon. I'm gonna have you dangle your feet for me. I'm gonna assess your patellar. Then your plantar flexion. Okay, and your Achilles. Okay. Alright. And then everything looks and feels good. So I would wash my hands and document. Finish skill.